So from what we know, the brain starts developing right from the fetal stage. Can you take us through this a little bit? What is happening in the fetus? And all these therapies that you talk about, can they be administered to the mother and help the child in some way at the fetal stage?
Both very interesting questions. As far as the fetus is concerned, the earliest neurological development is the neural tube. And in fact, when we try to do early scans as preventive health measures, ultrasounds, women are mandated to have their first one before the age of before 3 months of pregnancy. What we do look for is whether, one of the things we look for is whether the neural tube is intact and the neuraxis is developing as normally as it should. Because defects in that are an indicator of future disability. Sometimes one fails to pick up the defects and one picks up the defects in the 5th month scan, and that could be a little late to do anything. So tracking the development of the what starts as the neural tube, the neuraxis, which results in the brain and the spinal cord developing in the fetus, is extremely important part of antenatal health. And it is something that, as much as looking at the fetal heartbeat, looking at the fetal position, looking at the general health and development of the fetus and so on, this is an extremely important part. And of course, today there are other genetic and other biological parameters we can check as well in children. Now, for the mother, one thing which is very, very important, which brings us to what is the basic framework of why people have developmental disabilities, is an optimal environment. So the mother provides that optimal environment for the fetus. And anything that disturbs the mother's optimal environment is going to, by default, have an impact on the developing fetus's optimal environment. And the Swedish studies of developmental disability, that's what they've shown, that invariably children who go on to develop a developmental disability, the optimal environment has been disturbed either during pregnancy or around the time of birth, or indeed soon after birth. So optimality is a very, very important concept. And when it comes to integrative health, it has a lot that it can offer a pregnant mother who is preparing to deliver her baby. I mean, now a lot of people do, for example, yoga pre-pregnancy. A lot of people do antenatal exercises. But being calm, being free of anxiety, being in a good mental space, being able to enjoy things like music, all these are obviously extremely important for the mother and will have very positive influences, we believe, on the growing fetus. And therefore, apart from these things as experiences or as part of programmed classes and so on, which a lot of people do today, integrative health can be helpful. There's another thing. As you know, when a woman is going through her pregnancy, one of the things that spoils the optimality for the fetus is any medication the woman is forced to take, because many of these medicines will cross over and might have an impact on the fetus. And therefore, a reduction of medication and the use of non-pharmacological techniques as an integrative health can be very, very useful to women when they are going through their pregnancy, because inevitably you will get symptoms of one kind or the other, and to be able to solve those symptoms or get relief without medication is probably extremely important, more important at that time than any other time in a woman's life. So,
right. As babies grow, how does their brain develop? And how can parents support this this brain development? I'm thinking optimality may be key here too, but I'm sure you'll take me through the details.
Oh yes. One of the interesting experiences talking to parents from abroad who are now visiting post pandemic is that for a couple of years or more, the small children have been quite isolated, even more isolated than usual. And if you think contrast an Indian setting with, say, somewhere in the US, you could live for months in a house and not really know your neighbors, which is something that never happens in India. And what happened during the pandemic there to many of the children I'm seeing now is that their interaction was only with their parents, and their interaction was otherwise restricted to the television. So other humans were strangers, and meeting other humans was something they never did. Now, why am I saying this? I'm saying this to say that there is something to be said for diversity of experience for a child. And for a child to have a great diversity of experience and soak it all in is extremely important, because brains are very plastic and adaptable. And children in particular, because they are so curious and they pick up everything from their environment, learn so much from their environment. So, if you ask me what is right for a child, I would say a whole diversity of experiences, a smorgasbord, obviously, but without overloading a child, is probably going to be very, very good for a child to interact with different people, different places, different environments, experiences, animals. All this is very good, as is, say, music, as is movement through dance or sport. So I think exposure is good. Graded exposure, purposeful exposure is very good. And we talked about multiple intelligences earlier. If a child shows a yen for a particular type of activity, then obviously, even more so, giving that child very sustained and very meaningful exposure is probably very important too as they grow up.